almost finished. This also applies to water terrorism. Very, very important to include community healthcare providers in your planning, because you're going to want them by your side and on your team. And speaking of teams, here's my model. You really need to include a multidisciplinary approach for preparing and responding to water contamination, whether it's at the local or regional level. That includes natural or intentional contamination. This is a list of folks, it's just the beginning of who you need to have on your collaborative team. Healthcare providers, public health officials, the water utility practitioners, emergency management, law enforcement, and regional government officials, public risk communicators, and media representatives. And the important point at the bottom, you really want to make sure you have private sector, industry, and small businesses included in your plans as well. It's really important for our Strategy 8 team. You have to appreciate the fact that the team has to understand their critical role and the importance of communicating effectively, coordinating their efforts, and collaborating to protect the public's health. Those are the 3 C's of disaster preparedness that absolutely apply to water. Now, this isn't a complete model, but this is a good start. If we have the people that were responsible, our population, the water consumers, our patients in the middle, you really need to have a lot of arrows going both ways. Drinking water and law enforcement need to be talking to community leaders, and public health need to be communicating with medical and emergency response. Everybody needs to be part of this network. The problem with this is, in most communities, these are groups that are not traditionally used to working together. We've done a much better job with disaster and terrorism preparedness since 9/11, but it's really important that everybody include this complex of team approach to their community preparedness. Just a couple more slides here. Also need to encourage you to customize your drills and plans. As you can see, the small little boat down there with those emergency responders. If you've got industrial complexes in your community, they present very specific challenges that you need to be worried about before an event occurs. And the last point I want to make is really, it's very important to arm all of these medical, public health, emergency response folks with tools that work, things that are practical, things that they can use. It's extremely important for them to have ready accessible tools and practical information when they're facing these really complex situations. And that's why we actually developed this website, and you have information. I'm going to sort of quickly fly through these slides, but it was really created to provide that large community response and give you some basic starting point from a medical point of view to deal with these natural or intentional contamination events and provide people with the resources that they need. So this website's free, it's available 24/7, a lot of information. Again, focus on the risk evaluation for the most sensitive populations. After 9/11, as I said, the EPA provided me funding. There's an entire section just dedicated to water terrorism. So I would encourage you to take a look at these websites and encourage you to send them on to your colleagues who are dealing with many of these issues. Always astounding when you come up with something that's available for free globally. When I started this process, I had no idea 4 years ago whether anyone would even look at this information. In 4 years, we've had almost 10 million hits for information to this website from a whole host of diverse audiences. And interestingly, even though it was written for U.S. physicians and U.S. disaster managers, we now have almost 400,000 visitors from 89 countries. So there's clearly a need across the world for these kinds of resources. And a lot of other organizations have linked to this website as a reference. So I would encourage you definitely to use it. So ultimately, really, my goal is to provide you as a physician with ready-made disaster tools to help your public health, medical, and disaster preparedness community to deal with some of these complex medical issues that I've discussed with you briefly today. So I applaud you for your commitment to this global problem. I thank you for your attention this afternoon, and I will turn it back to Dr. Valcott.